Hi, my topic is Mers-Cov. Coronaviruses. Coronaviruses are common viruses that most people get sometime in their life. Human coronaviruses usually cause mild to moderate upper respiratory tract illnesses. Coronaviruses are named for the crown-like spikes in their surface. There are three main subgroupings of coronaviruses, known as alpha, beta, and gamma, and a fourth group provisionally assigned new group called delta coronaviruses.
Coronavirus infection in the UK brings the number of global cases up to 12. So this potentially fatal SARS-like virus was first identified in September of last year, and experts now say they would not be surprised if it came to the US. Senior medical correspondent Elizabeth Cohen joins us now. So Elizabeth,
the human coronaviruses spread from an infected person to other through the air by coughing and sneezing and close personal contact such as touching and shaking hands.
It causes a high fever, breathing difficulties, and can eventually lead to organ failure. Experts are now racing to find the source of the virus and to learn more about how it spreads. In its current form, it's not contagious enough to start a pandemic, but with its high fatality rate, it's a threat that health officials are taking seriously. Rebecca Morrell, BBC News.
The coronaviruses are a large family of ribonucleic acid viruses capable of infecting humans and a number of animal species. Viruses of this family cause a number of animal diseases. Middle East Respiratory Syndrome, caused by a coronavirus called Mers-Cov, is a viral respiratory illness first reported in Arabia Saudi in 2012.
With the 10th global case of a coronavirus being found in northern England, many people want to know more about this potentially fatal virus. The coronavirus is a large group of viruses that affect the respiratory system. Patients have presented with fever, coughs, and breathing difficulties. It causes pneumonia and sometimes kidney failure. The human coronavirus was identified in the mid-1960s, and cases have risen since then. Contrary to popular belief, the virus isn't linked to the popular lager brand. It is in fact named because of the crown-like projection on the surface of the virus. Coronaviruses are very fragile, as they only survive outside the body for around 24 hours. The viruses are also easily destroyed by household detergents and cleaning products. Despite this, the virus can be lethal, and out of the 10 reported cases, 5 have been fatal. As with other respiratory infections, the coronaviruses are spread through the air. When an infected person coughs or sneezes, tiny droplets containing the virus become airborne and can be inhaled by someone nearby. To avoid catching or spreading any viruses, make sure to follow the Catch It, Bin It, Kill It campaign. Cough or sneeze into a tissue, then bin it to kill the virus.
Most people who have been confirmed to have Mers-Cov infection developed severe acute respiratory illness. They had fever, cough, and shortness of breath. About 30% of people confirmed to have Mers-Cov infection have died. This virus has spread from ill people to others through close contact, such as caring for or living with an infected person. First U.S. imported case of MERS was confirmed in a traveler from Saudi Arabia to the U.S. on May 11, 2014. The prevention. Healthcare providers are advised to maintain vigilance. Recent travelers returned from the Middle East who developed SARI should be tested for Mers-Cov, as advised in the current surveillance recommendations. People at high risk of severe disease due to Mers-Cov should avoid close contact with animals when visiting farms or barn areas where the virus is known to be potentially circulating.